You're tuned to Planet Vero Radio. I am Cindy Schwartz. We are broadcast on iHeart, and we are also podcast on Spreaker. This is the Patient Partner Show. I have my co-host with me on Skype, Jeannie Roller. We're going to get right into it today, and we're going to talk about medical records today. I mean, that's kind of a sore subject, I think, both for Jeannie Roller and myself, because when we did order our records, and yes, we were able to do that. I'm in Florida. Jeannie Roller is in Indiana. And we were able to get the records, but it just kind of went on and on and on about what wasn't in there, what was in there. I don't want to say the word falsify, but the information that I read, I wasn't that person that happened to. So however you want to word that. And so many things were left out, where the context wasn't correct, in my opinion. And so we've both delved into it. We've had other people on the show talking about different states of where they tried to get their medical records. And yes, for the listeners, if you have any problem at all, you should definitely push to get your medical records. So at least you know what is there that's going to follow you around for the rest of your life, because it's basically written in stone in your medical records. Because in Florida, the research that I did, the medical provider owns those records. And so, Jeannie Roller, I'm going to let you roll with it, no pun intended, and let's hear it.
Well, medical records can be very dangerous, for one thing. If the things in there are not true, such as if you do have an allergy to a certain medication and they decide for whatever reason not to note that you have an allergy, then that will follow you forever. And that's what happened to my husband. He noted that he couldn't take certain medicines, and they refused to make a note of it. And in fact, they gave him those medicines. And in fact, then he became critically ill because of them. So forevermore, it will be in his medical records that he can take those medicines, even though he voiced he couldn't. And later on, when he went back to the same medical provider, they wrote it down that he couldn't take them. And then later, when we requested the medical records, we could see that they had crossed it out. Mm-hmm. Medical records are just, I mean, especially with the ERHs, or electronic medical records, mm-hmm. or health records, whatever you want to call them, they are especially problematic because they have been devised to be able to protect them from malpractice suits. This means that they have prompts in those medical records when they're inputting them saying, you needed to do this. And so they'll put in, we done that. They may not have done it, but they will put in there because the medical record system itself is devised to protect them. So in my husband's medical records, he had a nurse who didn't do certain things, but because of how the system is devised, she put in there, she did it. Mm-hmm. And it is a very dangerous system. In Indiana, you own the information, the medical provider owns the actual medical record. And that's the way it is in most states. There are a few states that the patient owns everything, but I'm not really sure what that means, because in Indiana, like they said, my husband had a baby. Well, we cannot get that corrected because the medical provider refuses to correct it. So that will follow him around forever. And basically, because of all the hundreds of entries in his medical records, and this one medical encounter is wrong, like they had a procedure in there he never had, his medical records are useless. He cannot use them because they are, in fact, dangerous to his overall health. Mm-hmm. Yeah. And I'm sure, Cindy, you are aware of that too in yours, that it is dangerous to your health to use some of those medical records.
Yeah, so I'm going to interrupt you real quick, Gene. I'm going to make a couple of points. We had John A. on a couple of weeks ago, and he's from Minnesota. So the things that we talk about, they're happening in all 50 states. We have people from, I don't want to list all of them. I don't want to waste the time for that. He had an exceptionally difficult time to get his records, and he also did the same thing. He stated some medications that he was allergic to, and in that pre-prompted system that the medical community uses, and it's different in each hospital, each facility, or whatever, I'm sure, the doctor never hit enter. So he typed it on the screen, but supposedly never hit enter, so he got the drugs anyway. And these were drugs that he was had side effects, allergic allergies to. The same thing happened to me. They just override some of the things and don't take it seriously, which I can't understand why that you would ask a person why, what allergies you have, what reactions do you have to these drugs, and just take it upon themselves, because they don't really know you. They're seeing you for 5 minutes and say, well, those aren't really valid reactions, which is what they told me. So I don't get some of this stuff.
That explain that they really don't believe patients. They believe that patients lie, and they want to use certain drugs. Last week we talked about Versed. Versed is one of those drugs that they want to use on just about every patient. So if you come along and say you have an allergy to it, they won't put it in your records because they want to use that drug.
Yeah, well, that's what happened to me. And that's what happened to John A. and many other patients. I just go back to him because he was the most recent that we've had on the show. And so the other thing that I want to interject in the paperwork that I found that a lawyer wrote, of course I got it online, but a lawyer wrote the different specifications in Florida and how to get the medical records. You have to first address your medical provider and ask them in writing that you want to have some of these things amended. So it is valid that it is legal that you can, as the patient, have these things amended. I mean, will most of the providers amend them? They'd have to talk for themselves. I mean, in my instance, I would think that would be like the brick wall trying to come apart by itself. It's not going to happen. They're not going to do that. Right. But in Florida specifically, you can override that, and you can insist, again, it's all in writing, that you put a piece of paper into your medical records that explains different things. It has to be a very short scenario. I mean, maybe one page, that's my, say on it. I'm not really sure what the length of it is, but you do get the initiative to do that. I mean, what does it do ongoing? I have absolutely no idea. And I know that I'm frustrated, as you are, so many people that we talk with, Jeannie. Why is this happening, and why are patients so expendable? And why aren't these things being taken seriously, especially these high-powered drugs? Because down the road, the side effects are just so compounded over and over again, specifically how dangerous these drugs are and how mind-altering they are, and why they're, like, to me, my opinion, being used willy-nilly.
Well, my opinion is it's all about power, control, and greed. It always comes back to those three things. They use these drugs because they can do procedures faster. They don't have to worry about your feelings. They don't have to worry about much of anything about you. If they kill you, well, there's another patient to take your place. And it's about money. They want to do things fast because they want to make money. They want to get out of there onto the next patient and have their day at an end. So they really don't care that these medical records are supposed to be a story of your encounter. And that's what the electronic records do. They use phrases, standard phrases. They cut and paste. So one thing that I have found that a lot of people have in their medical records is they cut and paste. We had informed consent discussions, when a lot of times they don't. But that is a cut and paste prompt that's in these medical records. So they put it in there regardless of whether or not they did it. Once it's in there, it is like it is written in stone. You cannot do anything about it.
Yeah, those are all pre-generated is what they are. That's just, you click on the, you can see it if you do order your medical records, you can see it. I mean, mine, you can see it specifically on there where they had a couple of different choices that they could pick, and it's, they're going to pick the right ones that they need for that right time. I mean, that's my opinion. Maybe it's not true. Well, maybe they did do some of these things, but I saw for myself that they didn't, and I brought it to their attention. And I know, and the argument goes on and on. So we have like a couple of seconds left. I want to give kudos to Misty Roberts at Medical Patient Modesty. She does help us out. She's one of our patient partners. Her website is modesty.org. Jeannie Roller, you are on Twitter at Rights4Patients with the numeral 4. And, anyone listening, join the discussion. We're all in this together. We're just trying to help each other out. We're not medical doctors. We're not, we didn't go to medical school. We're not surgeons. We're not anything, but we do know what happened to us. And we know that we want to change that, and we don't want to see it happen to anyone else. So please stay tuned to Planet Vero Radio.